As I stated earlier, conflict should never be avoided. It is a normal occurrence. For this reason, we must learn effective ways to integrate management into the workplace. In an article written by Dr. Cynthia Clark titled Ending the Silence: Antidote to Incivility, she cited a method known as cognitive rehearsal techniques. This method is one that is used to prepare people for uncivil encounters through 1. Pre-briefing, 2. Identifying scenarios for simulation, 3. Role-playing and rehearsing responses, 4. Practicing simulated scenarios repeatedly, and 5. Debriefing after the encounter. All of these scripted methods are what Cynthia Clark recommends for us to use so we can prepare ourselves mentally for any conflicts that we may encounter, so that we have time to actually think about what we're going to say before we say it, so we don't say something reflexive and end up causing more conflict. The different cognitive rehearsal techniques that she utilizes is the CUS model, which is an acronym for concerned, uncomfortable, and safe. And then she also recommends the use of the DESC model, which is describe, express, suggest, and consequence. Both of these are acronyms that are used to help healthcare professionals communicate effectively and respectfully to maintain patient safety, and were created by Team STEPS. I'm going to go a little bit more into the details of the DESC model because we're more familiar with the CUS model through our readings, but they're basically pretty similar in the way that they manage needs and communication among healthcare providers. So for D, describe the situation or behavior. E, express your concerns about the situation. S, suggest alternatives and seek agreement. C, consequences, which means state the consequences of inaction and seek consensus. So basically what you're doing is when you're talking to the person, you're asking if they're agreeable to what you said, or you're clarifying if they understood what you need from them. The last method that she recommends is I messaging, which focuses on perceptions or beliefs of the speaker rather than attributes of the listener. This avoids blame shifting. In this manner, it provides a constructive methodology for how you handle dealing with others, so that instead of saying you did something, you say I, like you tell the person how you were made to feel, rather than throwing something onto them and saying you did this or you did that. Instead, you would tell them I feel a certain way about this. So what you're doing is you're basically going to them with constructive criticism. You have to be honest, but you also have to be constructive and respectful, and it's basically following a just culture. The main idea of this is not to blame the person that you're talking to with the I messaging, because the I focuses on yourself, not the person that you're speaking with.